Hi! Today, I will discuss to you how our emollient laxatives or stool softeners used to treat constipation. Everybody poops. It is one of those facts of life. The average person poops between 3 times a week and 3 times a day. So, by the time you are adult, you are an experienced pooper. But sometimes, with the right diet and exercise, you still need help with your number 2. And that's where laxatives comes in. Constipation is pretty common with anywhere between 2 and 30% of people experiencing symptoms of any given time. It can be caused of lack of exercise, many medications, or certain diets. Changing your habits might solve the problem, but not. There is a whole bunch of laxatives to make your pooping experience more enjoyable. And one of it is emollient laxatives, aka stool softeners. Those decrease the surface tension of fatty stools, allowing them to absorb water and become soft. Like soap and detergent makes water and oil mix when you're washing your hands. Commonly known as stool softeners, emollient laxatives such as Colace that contains Docusate, a surfactant that helps to wet and soften the stool. Although it might take a week or longer for emollient laxatives to be effective, they are frequently used by those who are recovering from surgery, women who have just given birth, or individuals with hemorrhoids. So let's talk about one of the example of stool softener. You might have heard it always, and that is dolcolax. What is dolcolax? This is a product used to treat constipation. It contains Docusate, known as a stool softener. It helps increase the amount of water in the stool, making it softer and easier to pass. Its indications: for per RM or PO, prevention of constipation in patients who should avoid straining, such as after MI or rectal surgery. For rectal, used as enema to soften fecal impaction. And for its action is to promote the incorporation of water in the stool, resulting in softer fecal mass. May also promote electrolyte and water secretion in the colon. And its therapeutic effects: softening and passage of stool. The pharmacokinetics: absorption. Small amounts may be absorbed from the small intestines after oral administration. Absorption from the rectum is not known. Distribution unknown. Metabolism and excretion. Amounts absorbed after oral administration are eliminated in the bile, and half-life is unknown. Time action profile. Softening of stool. Route per RM and rectal. For its onset, per RM is 12 to 72 hours, and for rectal 1 to 15 minutes. Contraindications or precautions. It is contraindicated in hypersensitivity, abdominal pain, nausea, or vomiting, especially when associated with fever or other signs of an acute abdomen. Use cautiously in excessive or prolonged use may lead to dependence, should not be used in prompt result, and desired OB lactation. Has been used safely. Adverse reactions and side effects. For EENT, throat irritation. For GI, mild cramps and diarrhea. And for derm, rashes. Route and dosage. Per RM, adults and children are greater than 12-year-old, 50 to 400 milligrams in 1 to 4 divided doses. Per RM, children under 3 to 6 years old, 20 to 60 milligram in 1 to 4 divided doses. Per RM, children 3 years old, 10 to 40 milligrams in 1 to 4 divided doses. Per RM, infants, 5 milligram per kilogram per day in 1 to 4 divided doses. Rectal, for adults, 50 to 100 milligrams or 1 unit containing 283 milligrams Docusate sodium, soap, and glycerin. Availability or the generic available. Docusate calcium capsules, 240 milligrams over the counter. Docusate sodium generic available. Tablets, 100 milligram over the counter. Capsules, 50 milligram over the counter, 100 milligram over the counter, and 250 milligram over the counter. Syrup, 20 milligram to 5 ml over the counter. Liquid, 50 milligram to 5 ml over the counter. Enema, 283 milligram or 5 ml over the counter. in combination with stimulants, laxatives over the counter. And for its nursing implications or assessment. Assess for abdominal distension, presence of bowel sounds, and unusual pattern of bowel function. Assess color, consistency, and amount of stool produced. Potential nursing diagnosis, constipation as indications. Implementation. Do not confuse Colace with Cozar. Do not confuse dolcolax or the Docusate sodium with dolcolax bisacodyl. Do not confuse coapectate stool softener to Docusate calcium with coapectate bismuth subsalicylic. This medication does not stimulate intestinal peristalsis. Stimulant laxatives may be required for constipation. Per oram, administer with a full glass of water or juice. May be administered on an empty stomach for full rapid result. Oral solution may be diluted in milk, infant formula, or fruit juice to decrease bitter taste. Do not administer with 2 hours of other laxatives, especially mineral oil. It may cause increased absorption. For rectal, administer as a retention or flushing enema. Patient or family teaching is needed. And for patient or family teaching, advise patient that laxative should be used only for short-term therapy. Long-term therapy may cause electrolyte imbalance and dependence. Evaluation or desired outcomes. A soft form bowel movement usually within 24 to 48 hours. Therapy may take 3 to 5 days for results. Rectal dose forms produce results with 2 to 15 minutes. In short, stool softeners soften stool and make it slippery, making the stool easier to pass. This work in the colon and take effect in 6 to 8 hours. So, no matter what is your poop situation, there is a laxative for you. At the end of the day, a healthy diet and exercise goes a long way in keeping your body running smoothly. But the next time you're feeling bloated, you have an option in helping nature along. Thanks for watching.